Decontamination plays an important part in controlling infection in hospitals. It prevents the spread of microorganisms and other contaminants that may threaten the health of human beings or damage the environment. Decontamination is the process of making an object or area safe by removing contaminants such as microorganisms and hazardous materials, including chemicals and infectious substances. Decontamination process includes 3 steps: disinfection, cleaning, and sterilization. Decontamination of all used items should be done in their respective units like labor rooms, operation theatre, etc. Disinfection or decontamination is done using either 1% of sodium hypochlorite solution, that is the raw supply, or by diluting it to 0.5% chlorine solution as per the necessary requirement. 1% sodium hypochlorite solution is used as disinfectant in case of blood spill or blood-stained items and in toilets. (0.5% chlorine solution can be prepared by mixing equal amount of 1% liquid hypochlorite solution and water. The container containing the freshly prepared chlorine solution must be immediately covered to prevent the loss of chlorine gas. Freshly prepared chlorine solution remains active for 6 to 8 hours after the constitution if kept covered. If the solution becomes turbid, immediately discard and prepare a fresh one. Chlorine solution is effective against a wide variety of microorganisms such as viruses, fungi, bacteria, and spores. Immediately after use, the instruments should be soaked in 0.5% chlorine solution for 10 minutes. After soaking, rinse the instruments and clean them in a container of water. Scrub the instruments using brush and detergent solution to remove the visible dirt and remnants including bloodstains. Rinse them thoroughly in another bucket of fresh water to remove all the detergent and then air dry and sterilize. Instruments that need sterilization have to be sent to the autoclave unit. Signal lock must be used while sending the items for autoclave. In each of the drum or tray, 3 signal locks must be used. One at the bottom of the items placed, one on top of the items, and the last one outside the tray or drum to indicate complete sterilization. Place the items in autoclave loosely, then close the lid. This allows adequate permeation of steam inside the trays and drums. The wrapped items have to be kept for 30 minutes and unwrapped for 20 minutes at a temperature of 121 degrees centigrade and pressure of 15 pounds per square inch. Allow the autoclave to cool for 30 minutes before opening it. A detailed record with date and time has to be maintained for every instrument that is sterilized. Before entering the critical area, the staff should leave their shoes outside and wear clean slippers. After wearing the slippers, the staff should wash their hands following the 6 steps of hand washing. Then they should wear the rest of the PPE. Cap should be worn in such a way that no loose hair is outside and it entirely covers the head and the ears. The mask should be worn over the nose and mouth, and the part that is on the nose should be pressed so that it covers the nose properly. The apron should be worn in such a way so that it does not get soiled. The sterilized gown should not get soiled while wearing it. Surgical gloves should fit snugly over the wrists and hands. While wearing the gloves, make sure that it is pulled over the ends of the sleeves of the gown. Now the staff is ready to enter the operation theatre. Staff should remove the gloves in 0.5% chlorine solution. Wash off the blood and leave the gloves in the container. After it is left for 20 minutes, it can be disposed of in the red dustbin after tearing it. Then the gown should be removed. If the gown has got soiled with blood or body fluids, soak it in 0.5% chlorine solution. Rinse with clean water. Wash with soap and water. Hang to dry. The mask and the cap can be taken off and put in the yellow container. 6 steps of hand washing. Wash hands following the 6 steps of hand washing. If the gown has to be sterilized, it should be sent to the autoclave unit.